Hello, my name is Dr. Alan Lawrence. Menopause is a natural state of life. Thanks to improving health care and preventive approaches, women are living longer. But are they healthier and happier? In this presentation, we'll look at the use, risks, and benefits of hormone replacement therapy. In subsequent programs, we'll look at other problems and issues commonly associated with menopause. As women enter into menopause, we begin to see a number of problems, some overt and in the form of symptoms, and some less clearly defined, often in the form of risks associated with aging and the loss of normal hormonal production. In this slide, we see the range of symptoms from hot flashes, night sweats, temperature intolerances, decreased sexual desire, dryness of vagina, pain on intercourse, bladder infections, stress incontinence, skin changes, and premature aging, as well as mood swings, bouts of depression, confusion, impaired memory, sleep disorders, decreased concentration, fatigue often occurring during the middle of the day, decreased spatial reasoning, muscular coordination, and muscular and nervous tension. All of these are symptoms that occur to some degree or another in women as they enter into and move through the menopause, and often into the postmenopausal phase, and frequently into ages as far as 70s, 80s, and even the 90s. These are symptoms. They are not the risks of menopause, but when we look at the risks of menopause, we see that just simply entering into the menopause increases the risk of cardiovascular, heart disease, and stroke, osteoporosis, cancer, non-malignant surgical problems, and miscellaneous gynecological problems that are related to or caused by menopause. When we talk about hormone therapy, what we're talking about is a prescription for either female or female and male hormones, which act to replace or reestablish positive hormonal states in menopausal women. HRT can be given or prescribed in a number of different ways, including topical creams, oral preparations, injections, or even pellets that are inserted under the skin. For our sake, we will not specifically talk about a particular method, but rather the general understanding about hormones and their value being replaced in menopausal women. There are also two different types of hormone replacement therapy. There is the use of synthetic hormones, and there's the use of bioidentical, sometimes referred to as natural hormones. Synthetic hormones have been used for more than 50 years. They often included two types of hormonal therapies: synthetic menopausal replacement, the most common of which was Premarin and Provera, and then there's oral contraceptives, birth control pills. Natural, or better still, bioidentical hormones are female hormones that are exactly identical to natural female hormones, the same identical hormones that are made by the woman's body. Bioidentical hormones are safer, they are more protective than synthetic hormones. Bioidentical hormones have less side effects and lower risk profiles. Hormone replacement therapy, or HRT, usually refers to the prescription of a series of female and male hormones that are natural to the normal female's body. Starting even before the onset of menstruation, young girls and women produce three sex hormones. The main hormone that we consider as a female sex hormone is estrogen. This is made up of the active hormone estradiol and two metabolites, estrone and estriol. The second hormone we talk about as a natural female hormone is progesterone. This is a hormone of the second part of the female cycle, the post-ovulation period. Its role is to prepare the uterus, particularly the lining of the uterus, for implantation and pregnancy. The third hormone is both a male hormone and a female hormone, produced by the ovary to some degree, the adrenal glands to a larger degree. Testosterone is made in very small amounts and has a number of very valuable properties in women, including that of increasing the woman's libido or interest in sex, helping her develop muscles and healthy musculature, improving her appetite and giving her energy and a kind of aggressiveness that allows her to be competitive in the world. The estrogen group is responsible for secondary sex characteristics in women: the stimulation and growth of the breasts, the stimulation and growth pattern for pubic hair, the female curves, soft skin, and the voluptuous female appearance. All of these are secondary sex characteristics that act in a number of different ways. One, to give her a sense of female identity, but also to draw males to her so that she can mate and reproduce. On a regular monthly basis, estrogen is essential for the preparation of the lining of the uterus and the preparation of this lining for implantation of a fertilized fetus. After the onset of menopause, estrogen protects the heart, prevents menopausal symptoms, protects against osteoporosis, and maintains secondary sexual characteristics. Progesterone has multiple values as it supports new pregnancies, the overstimulation of the estrogen against the breasts and the lining of the uterus, which can ultimately lead to increased risk of uterine cancer. It also protects the bones from osteoporosis. Testosterone stimulates protein metabolism of the woman's body, builds muscle, and increases sexual libido. It can also protect the woman's bones from osteoporosis. It is important to avoid synthetic hormones, especially Premarin and Provera. Synthetic hormones act to increase the risk of cardiovascular disease. They also increase risks of breast cancer, blood clots, and a number of other problems that no woman needs. We believe that it's important to use only bioidentical hormones, as bioidentical hormones decrease the risks of cardiovascular disease, breast cancer, and a number of other risk factors that no woman needs or wants to have. Hormone replacement therapy can be used in a number of different ways. As we talked about hormone replacement therapy, we talked about the use of estrogen, progesterone, and testosterone. However, in some women, estrogen replacement therapy, or ERT, is used on its own. And remember, when considering ERT, remember to only use bioidentical estradiol. Estradiol can be used to decrease your risks of osteoporosis, breast cancer, ovarian cancer, and high blood pressure. If you still have your uterus, estradiol alone without progesterone may overstimulate the lining of the uterus, and it can increase the risk of endometrial thickening with postmenopausal bleeding, and it also can increase the risk of uterine cancer when the stimulation is prolonged and significant. If you do not have a uterus, these will not be a problem. Estradiol has been shown in some women to increase their risk of gallbladder disease. Should you have gallbladder problems, it would be wise to talk with your doctor to make sure that you're not at risk for gallstones or gallbladder disease because of use of hormone replacement therapy or estrogen replacement therapy in this case. Another way of using hormones is to use progesterone replacement only. Progesterone replacement only is often used in women who cannot use estrogen, either because of the fact that they have complications or risk factors, or because they have not used estrogen in greater than 10 years, and the risk of blood clotting disorder can go up in women with using even bioidentical hormones if they have not been on estrogen hormone therapy for greater than 10 years. In these cases, progesterone is used independently, with or without testosterone. Progesterone on its own can decrease your risk of uterine bleeding and uterine cancer, osteoporosis, breast cancer, ovarian cancer, PMS-like symptoms, and high blood pressure. Progesterone appears to offer no increased risk of any significant health problems. Obviously, when you're using hormone replacement therapy, you want benefits and you want the least amount of risks possible. HRT may have increased risks of causing uterine bleeding. When this happens, increasing the dosage of progesterone may solve this problem quickly. If progesterone does not work and bleeding persists, you need to see your doctor and be sure that this is not an early sign of uterine cancer. Each of these forms of ERT, HRT, or PRT has its own intrinsic benefits and risks. Whether your doctor prescribes one or the other will likely depend on factors such as your hormonal needs and goals, your overall health, your family history, your prior medical history and the conditions that you've had, your age, how long it has been since your body made or used prescription estrogen, whether you are a smoker, and if you have increased risk of blood clotting disorders. Please remember, we strongly advise against the use of any or all synthetic hormones. This is important because the risks are greater on all levels with synthetic hormones. Think smart and be smart. Menopause is simply one stage of life. You can make the best of it if you understand it and know how to work with it, and especially if you don't resist or fight it. Hormone replacement therapy, HRT, ERT, or PRT, can help make menopause safer and less problematic for you. In order to get the best results, we suggest that you find a competent and supportive medical doctor, one who will evaluate you and help you to find the correct combination of hormones, whether it be HRT, ERT, or PRT, for your basic needs. Doing this will help you to decrease the risks, increase the benefits, and increase the quality of your life. Thank you for watching Breezing Through Menopause, program number 3, Hormone Replacement Therapy, presented by Health Education Associates. The next show in the series is Breezing Through Menopause, program number 4, Osteoporosis. This is Dr. Alan Lawrence wishing you optimal health and wellness.